Welcome to our Wednesday Medicare training call every single Wednesday, 7 p.m. Central Standard Time. We talk about everything in regards to Medicare, the senior market, the growing senior market. Got 62 million people, going up every single day by 10,000 people a day. In 7 years, about 7.5 years, we're projected to have 84 million people in the market. So it's a phenomenal market to be in today, but it's an even better market to be in tomorrow. So tonight, we're going to talk about some stuff that goes on during AEP. We're going to unmute Gustavo, who has approaching around 20 clients in his first 30 days, to hear from him and what he does in order to get those sales. So he's doing a phenomenal job. If you do have questions, feel free to drop them in the group chat. You can, as well as drop them in the group chat. You can text me. Hopefully I see it. I may or may not see it. I'm looking down on my phone as we go through the actual training itself. And today we're going to have a pretty great call. So Vanessa had asked a question before. I think she got like kicked off or something, but she'll be back on shortly. And the question, just so everyone knows what it was she was asking about power of attorney. And if someone has a power of attorney, that's called an authorized representative in the eyes of the insurance company. So what they do is they say, hey, please have, what's the name of the authorized representative? And then as soon as you check that box, it's usually going to bring up more information that they need to know about it. Name, phone number, address, just like what you have with the beneficiary, the Medicare beneficiary. The power of attorney comes from the state, and every state, it varies as to what it controls. So we're talking about a medical power of attorney here, not financial, right? Not durable power of attorney. Okay. So we're talking about medical power of attorney. So if you go ahead and we just went on Google real quick, we could pull it up and we could say, what are the different types of POA in Texas, let's just say, and it'll give you the different types. So we have financial, which is also known as a durable power of attorney, depending on the state. And then we have a medical POA, and you can Google it. I'm sure there might be more. So there's a general power of attorney, durable power of attorney, special or limiting, and medical. So those are the 4 different types. Okay. So if you sit down with someone and they say, yeah, I have power of attorney. Okay, great. Does it cover everything? What type of power of attorney? Is it durable, right? Does it cover financials, or is it medical? Okay, it covers medical. Great. So since it covers medical for the medical power of attorney, what we need to then know is with the insurance company is, what do we do with that information, right? That's the next step. That's what we need to know next. Well, you don't need to do anything. You don't need the power of attorney documents. As long as you ask someone, they tell you that they have it. Can you provide the documents if the insurance company requests it? Yep. Great. That's all you need to know. We don't request the documentation. We're not looking at it. It's upon request of the insurance carrier. Okay. So they're signing as what's called the authorized representative of that client. I've seen agents look at it and see authorized representative and be like, hey, am I the authorized representative? No, you're not. You're the agent, not the authorized representative that acts on behalf of the client. So with that said, what we'll look at is a couple different things for housekeeping. Or Vanessa actually just joined again. So Vanessa, if you want, I can ask to unmute you again and you can finish your question, because you had a question. The guy's dual special needs, and in addition to dual special needs, he also has dementia, and he's got a power of attorney. So Vanessa, go ahead.
Okay, so he was on a Cigna Secure RX plan since 2009. So according to AEP, I don't have to do anything. They'll cancel the Part D plan, correct?
Correct. So if someone is in a Medicare supplement, okay, Medicare supplement, not Medicare Advantage. If someone's in a Medicare supplement and they are moving to a Medicare Advantage plan, you have to cancel the Medicare supplement. If someone is moving from a Medicare Advantage plan to just a prescription drug plan and original Medicare, or to another Medicare Advantage plan, you do nothing. Okay. CMS, Center for Medicare and Medicaid Services, handles that transition for you, which is the best thing in the world. You literally have to do nothing at all. You don't have to put, it's a replacement. You don't have to put that they have, what company they have, what plan number they have. Is the easiest thing in the world. CMS knows it all, and they do it for us.
Okay, perfect. Thank you.
Cool. All right. Did you have any other questions?
I did. I kind of forgot.
You're good. You're good. Just drop it in the group
Yeah.
chat as we go along and just
Okay.
let me know if you got anything. Cool. All right. I appreciate you. I'm going to put you on mute there, or you did it yourself already. Cool. All right. So let's go over some stuff today. All right. We're going to talk about AEP, annual enrollment period. This is not OEP. It's not open enrollment period. The two terms were once used interchangeably, right? When we got rid of OEP. And then what happened is we got OEP back. Okay. So AEP runs from October 15th through December 7th. That's coming on up. You can compliantly start marketing plans October 1st through October 14th. You could talk about the new plans for 2023, but you can't enroll them until October 15th. So what a lot of agents do is they talk about them, right? They get the commitment to the sale. They talk to the client. They come back out. They submit a ton of apps, right? So it's like the first week, you're putting in 30 applications, right? So you just do the math. Hey, what's 30 times 300, right? So that's all that you got to do. And that's, so basically the way I look at it is every 10 apps that I write, I make $3 grand. Okay. Plus an extra $50 for the health assessment. So that's $500. So I make $3,500 because in 2023, the commissions, they'll probably be about $300 in most states, excluding New Jersey, Pennsylvania, Connecticut, District of Columbia, and California. They will be higher by about 20 to 30%, okay, than those rates. So you get paid a little bit more money if you're going there, which is good. So that's, and because you pay more taxes probably. So with that said, that's AEP. So do not confuse that with OEP. OEP is open enrollment period. It's got nothing to do with what's coming up right now with AEP. Okay. That's January 1st to March 31st. And we'll worry about that when we get down that line. Okay. So that's a little housekeeping on that. Vanessa, you had your hand raised there. So I think you had another question. Did you have one more?
Yes, I did. Now
Go
I
ahead.
remembered what it was. Okay.
Gotcha.
So I have a second client. He is also a dual. And so, and he hasn't changed, he's had this same plan for about over a year. So I can change him now to a UHC, it's like a regional PPO that he liked, or do I need to wait till the
You could change
15th
them
of
right now.
October?
If you're going to change
now?
them, you got to change them today. So it's
Today.
effective
Okay.
September 1st, right? So it's
Okay.
like, hey, we got to get this done right now, basically, for it to be effective September 1st. Because if you wait till tomorrow, then it won't be effective till October 1st. So that's something that we want to do, today is the last day, obviously.
Tonight.
Yeah.
Okay.
So we'll do that. And then, or, if you wait till tomorrow, then it starts October 1st. So whatever the client wants to do, it doesn't really matter, but it just depends on his sense of urgency to get into the plan.
So I'd be signing them up for a 2022 plan, but when October 15th rolls around, will they be newer plans?
I'm about to go over all that actually. Yeah.
Okay. Okay.
Yeah,
Thank you.
that's a great question. Yeah, for sure. Definitely. So let's actually talk about that. I actually planted that seed so she would ask that question so we could lead right into this. No, I'm just kidding. But yeah, so I want to talk about what happens during AEP. Why is AEP important? For us as final expense agents, it's nothing crazy, to be honest with you. It's like really what it is it's just another selling season for us because we sell all year round, right? We run into clients. So for Vanessa's case, she's using a low income subsidy / dual maintaining, or I have extra help, or I have both Medicare and Medicaid, and I'm making a change to my existing plan. So something along those lines. So she's got, a ton of different options that she can use depending on the client situation. But those, there's going to be 3, maybe the guy had a change in status and he just got Medicaid, or, whatever it is, it doesn't really matter. So those are some examples for that specific case as to why he can change before AEP. So with that said, let's talk about what a client gets in the mail. So I always like to think from the client's perspective. So they get what's called an ANOC, ANOC. Okay. That's your annual notice of change or annual notice of coverage. It's one of those two. It doesn't really matter, but I'm going to Google it just to make sure. Yeah, annual notice of change. Okay, so I was right. So your annual notice of change, and what happens is that's really the best way for clients to know exactly what's going on, right? So that's going to be their change in plan, and let's talk about some of those changes that may occur, right? So this is what's important. This is the stuff that you're talking about with your clients, right? During AEP. Hey, so just so you know, you get that big old booklet from Medicare. It's about 300 pages that no one ever reads. And then you also get stuff from your current health insurance company, right? And we get the ANOC, and that's our annual notice of change. That's what you get, right? So you're reviewing with the client everything to make sure the stuff still stays the same. So today I actually had an example with a client that I have, existing client on a Humana plan, and the doctor's like, hey, we're not taking that plan anymore. Like middle of the year, it's like August, the lady's like, I got an appointment on September 7th with my optometrist, and I was trying to get a referral to go to the optometrist, and she's in an HMO, right? And she's like, I don't know what to do. They told me they don't do it, right? They told me they don't take it. So I just did a little bit of research, not much. And I went, got the optometrist number, called them on up. Hey, which plans are the ones you accept? Which ones are the ones you prefer? Basically, tell us, so that way we can look at it. I said, hey, I know with optometrists and dentists, we usually want to have PPOs. Is that the case with you guys? Yes. Okay. Do you take Humana? Do you take Aetna? Do you take United Healthcare? Do you take WellCare? Right? I ask about all the companies, so at least I know I have options. You take Cigna, right? And while I'm doing that, I'm looking at Sunfire and pulling that stuff up, right? So I'm just doing my research. I'm doing my due diligence. So that was a plan change in the middle of the year. But doctors can make changes during AEP. You'll see, hey, you'll get emails from the carriers. Hey, this company's no longer, or this orthopedic group is no longer in network with XYZ insurance company, or this orthopedic group is now in network with this insurance company. And that's stuff that's going to be coming through their ANOC. In addition to that, it's going to tell us about co-payments, right? Is there any change in co-payments? Did the hospital co-payment go up? Did the hospital co-payment go down, right? So stuff along those lines is important as well. What's their co-insurance on durable medical equipment or whatever it might be? That's important to understand. The deductibles change, right? Is there deductible on their prescription drugs where there wasn't before? Who knows? So stuff like that, you're going to see year over year changes, which is why it's great that all of y'all are selling right now. So we want to give everyone co-op money during Medicare selling season during AEP, right? But what I'm seeing with a lot of people is they're not even selling right now, right? So what's the point of giving someone co-op money to just buy leads if they're not even going to sell anything on it? Then we just lose money, right? It doesn't make any sense. So we got to make sure that y'all are selling, which is the whole reason why we started and get everyone geared up, months and months and months before, to make sure you guys are, the sales process is very smooth. It's fluid. It takes a little while to learn this stuff. It takes a little bit. It's new to you, just like final expense, right? Some of y'all, you've been in final expense for 2 years and there's still stuff, 3 years, and there's still stuff that you're learning, and you learn every day. You plug into the morning call and you learn something on the morning call, right? That means it's something you didn't know. So that's amazing that you get out there and you're always learning something. It's the same with Medicare. Okay. So the ANOC can also apply to prescription drug plans, not just Medicare Advantage or MAPDs. Hey, Gus, I'll unmute you shortly. Once I go through these different things, that's going to change. And then we'll review the stuff that you and I wanted to talk about too, and I'll interview you. So plan premiums can go up and can go down with prescription drug plans, right? Plan premiums can change with Medicare Advantage plans. In some parts in the country, there is MAPDs that do actually have premiums. So you go into a rural area. I had one agent that was out in a rural area, and there was literally one plan. That was it. And it was like, there was 1 0 premium plan with WellCare, and that was like literally the only competition. The other was like $20 with Humana, which could make sense if someone's on LIS or Medicaid, right? And then we can look at other options. So plan changes can change. New plans can come into your territory, into your area. So where do we learn all this stuff? It's the easiest thing in the world, right? We learn it all literally by looking at Sunfire. That's it, right? So it's not difficult. You familiarize yourself with your territory, with your area, which you should be doing. You look in Sunfire, you learn the plans, you educate yourself, right? You are literally a business owner. This stuff isn't handed to you. You got to earn it in life. If you want to get good at it, read this stuff. I don't know what it is. Okay, read about it. Just like all books, right? If here's something that I personally want to learn more about. I want to learn about corporations, right? So I bought a book on start your own corporation by this high level accountant who knows all about that stuff, right? So I want to learn more about corporations, S Corp, C Corps, right? LLCs, limited liability partnerships. I wanted to learn about partnerships, right? I wanted to learn more about that stuff. So I bought a book, and in the evenings when I'm done, I read it, right? When I go in the gym, when I go into the sauna, I listen to books. I listen to Audible. Every single Saturday and Sunday morning, I take my son to the park at about 8 a.m., right? Or 8:30, depending on when he gets up. And we go to the park, and I got one AirPod in, and I'm listening to a book, right? I always want to get better. I want to be in the best health, best shape, and have a great and healthy business model as well. So I educate myself, right? We have the trainings, but no one's going to, you can't just get this stuff handed to you. You have to learn it by actually taking time to educate yourself, which is what all of y'all are doing a great job of by plugging in these calls, by getting on the training and reading this stuff and going out to your clients and talking to them about it. So I just be a better agent, become a better agent, right? So that's super important. All right, so let's get back to this stuff. So we know so far, okay, I'm just going to recap where we're at so far on what happens during AEP. Client gets an annual notice of change, also known as an ANOC. They get that stuff. The best way for clients to know if the doctors still take it for clients, make a lot less legwork on you, is by calling. But since you have every single client saved in Sunfire, and since you just sent out your letters this past week to your clients, right, they already know that you're going to be talking to them when AEP comes on up. So you got your Sunfire, you pull it on up because you have every single client saved in there. The doctors are in there. You look at the plan. Hey, whoop, doctor still takes it. Boom. That simple. Okay. So doctors can change, networks can change, co-pays, co-insurance, and deductibles can change year over year. Plan premiums can change, right? And drug tiers can change. Okay, let's talk about drug tiers, and let's talk about how that can change and kind of what that means. All right, so our drug tiers can change year over year. A drug may not be on the formulary this year, and it might be on the formulary next year. So that's something that's important. So what's really cool about that when we look at our changes that we have for our drug tiers is we find that a generic drug might have come on the market because a patent might be up for a brand name drug. So let's say, for example, Plavix, which the generic is clopidogrel, right? So the generic for that blood thinner, at one point in time, Plavix had a monopoly on their specific, drug itself. They had a patent on it, and that patent lasts for X amount of years, 7 years, 10 years. And then after that patent's up, well, then everyone gets the formula for that drug and they go make it themselves in their lab, right? So every company is going to make it, or even that company makes it themselves, and they got a generic drug, which costs a lot less money because there's no more R&D, research and development. There's no more marketing that goes into it that jacks the drug price up because the cost of the pills are generally inexpensive, but it's all that other back end stuff of paying employees, research and development, marketing to get those drugs on the market, which there shouldn't even be marketing involved in drugs, but that's a different story. So you'll see that, hey, this year, things can change. Now you're wondering why I'm telling you all this stuff, because this is part of your pitch to become an expert when you're talking to the clients during AEP. Hey, just so you know, I got everything taken care of. Everything's all good. Well, I'm glad that you said that. Here's a list of things that can change year over year. And you wouldn't believe how many people get upset because the insurance company just sends them something in the mail. Most people, honestly, they're not going to read the 300 pages that they get in the mail of all this stuff, right? So here's some changes that can happen. And sometimes what happens is they go to their doctor and they end up with a bill for $1,000, or now this hospital is not taking it and it's a surprise. And you don't find out till you get there. Okay. So we don't like surprises with healthcare. Do you like surprises with healthcare? No. Do you like surprise bills? No. Right. So we want to make sure everything's taken care of. It just takes a couple minutes of your time. So that's what I was talking about with the prescription drugs and the tiers. A drug can go from one tier to the next. It can go from a tier 4 to a tier 3, right? So the cost is lower per tier. Okay. So let's go over tiers real quick. We have our tier 1, which is our preferred generic drug. It's the cheapest drug you can get. Got our tier 2, which is our non-preferred generic drug. Our tier 3, which is our preferred brand name drug. Tier 4, non-preferred brand name, and then tier 5, specialty tier, cancer drugs, like high level drugs. Okay, cool. Keep in mind, Medicare supplements, do they have anything to do with AEP? Nope. Nothing to do with it. People that have Medicare supplements, They have what's called a prescription drug plan. So this has nothing to do with med subs, but that's an intro into the door of what we just talked about. Plan premiums. Oh, did you know? So you're on the AARP plan. Okay, great. Did you know that it went from $20 to $45 this year? Right? Did you know that the prescription drug tiers can change, and a drug that might have been a couple bucks for you last year might be $50 this year? Right? So we got to know that stuff. That's part of our job and our due diligence. Okay. So Medicare supplements have nothing to do with this at all. You could change a med sup all year round. Okay. There's underwriting to make that change. They can change their standalone prescription drug plan, of course, during AEP. So it's open selling season on that as per usual. They can cancel their med sup and change from their PDP to a Medicare Advantage plan. That's one thing that they can do. So a very important thing too is we have to ensure that clients take action quickly on this stuff, right? Don't wait to the last moment to do this stuff. It's very important that we make sure that they are able to get this stuff done quickly and simply, and they don't have to stress about it. They don't have to worry about major changes. They don't have to worry about a million phone calls and people pounding on their door or whatever it is, a ton of stuff in the mail. We'll just take action quickly. We'll get it done. We'll handle it. We'll explain the changes, and you don't have to worry about it, right? So AEP, you really want to front load everything. Okay, so more leads up front and just run really, really hard. All right, so let's talk real quick about ways that clients can enroll themselves, and you'll run into this. And this is outside AEP, but it's all year round. So they can enroll themselves through Medicare.gov, believe it or not. So that's important. So they can literally go on there and they can click an enroll button. They get in the plan. Next, they can enroll directly through a carrier. But what happens when they call a carrier? When they enroll directly through an insurance company, right? And they call WellCare, hey, WellCare is going to tell them, they're going to pitch them why it's the best thing since sliced bread. But us as brokers, us as agents, we don't have an allegiance to an insurance company. I don't care about the insurance company. I care about the plan, the quality of the plan. Is this the best plan for you? But if you call one company, what do you think you're going to get? You're going to end up with one company, right? They're not going to shop around for you. You can have inbound call centers, which is decreased quite heavily. There's a lot of regulation put on the call centers and agents selling over the phone. So we've seen, I think it was something like 10,000 people laid off from the call centers because of this increase in regulation from CMS. And then you also have the last one, which is us, right? Field force, face-to-face, in-home agents. So that's another way that people can enroll in plans. So it's about the 4 different ways. So also, hey, one thing that I just want to touch on again is that premiums can increase for the Part D plans, and they can change. Okay, so even if someone's got a med sup and you can't beat the rate, don't think that you can't not help them. You'll definitely be able to help them. All right, so with that said, before I unmute Mr. Gustavo, does anyone have any questions on that stuff? Right? No, I went over it. It's good, right? 20 minutes. We got some stuff. Incorporate that in your pitch. It's a lot to take in. Okay, let me do a little recap on all this stuff real quick before we move on. Okay, so let's start from the top and we'll go through just a brief recap of it. So AEP, that runs October 15th through December 7th. Client gets in the mail a couple different things. One thing from Medicare, big old booklet. No one reads it. That's just how it works. It's all right. They also get an ANOC, annual notice of change for their plan. Best way for the clients to know if their doctors are in network or not is they do the legwork themselves and they call. Doctors can change in and out of the network, right? So an orthopedic group can leave a network, an orthopedic group can join a network. Co-payments, co-insurance, and deductibles change. Plan premiums can go up and can go down. Drug tiers can change. Something new is now a generic drug, whereas once it was only a brand name drug. So that means that the formulary can change, right? Year to year, they can remove some drugs from the formulary. They can add some drugs to the formulary every single year. Medicare supplements have nothing to do with AEP. Okay. You still got to go through underwriting. Med subs you could change all year round, but their drug plan, that's going to be the difference maker for them and making sure that's still the best thing for them if it is, because the prices can go up, prices can go down, drugs can come off that plan, drugs can get added to that plan. Okay. We want to ensure that the clients act quickly, expedite the process for them. They don't have to worry about, if you wait till last minute, it's always more stressful. Most of the time, hey, you have plenty of time to do it. But the reality is you get it done. It's done and it's over with. They don't have to stress about it at all. Okay. Ways that they can enroll is Medicare.gov through the carrier directly, inbound agent call, And last but not least, in-home face-to-face agents. So make sure that you're mentioning all this stuff to your client, and that is a part of your sales pitch. So let's see over here. Had a client tell me today that she wasn't interested in MAPD because Medicaid took care of all she needed. If she's on Medicare and Medicaid, then you definitely got to call me and we'll work through that, with the client, make sure that we're able to do that because I don't want you losing sales. So, you got to follow those main steps to the sales process. And then, definitely, get with me so that way we can lock that down because there's no reason for you to miss sales. And if she's on Medicaid, well, then she needs Medicare. So if she's just on Medicaid, there's nothing we can do to help her. It's like a FE client without a bank account. You can't help them. They have to be on Medicare. And if she's on Medicare and Medicaid, all the better. We can put her in a dual special needs plan, also known as a dual eligible plan. So we call that a dual SNP for people on both Medicare and Medicaid. So Armando, you can just get with me on that and we'll go from there. Does anyone have any questions on the stuff that we just covered real quick? Raise hand, anything along those lines. The bottom note here, which is prescription drug plans. Sometimes you'll see I ran into it today with Ryan. He had a client that there was a drug that wasn't on there. It's a generic drug. And I looked at it on Sunfire and it was $3 and change. It wasn't on the formulary. So just because a drug's not on the formulary, it doesn't mean y'all have to panic, right? You can literally go to GoodRx and type in the name of the drug and there's a coupon for it, I'm sure, right? A brand name drug's gonna be different. But if you're looking at it and here, I'll pull it up real quick. Let me show you guys a great example of this. So give me 1 second. Let me pull this one up. I'm going to pull up an example case here of someone that can have a prescription drug plan and a prescription drug plan. So I'll put in some examples for the prescription drugs so y'all can kind of see this over here. Okay, so here's an example of of 7 different medications here, right? So all that I do is, we've got 2 different plans. We got WellCare, and then we have the Silver Script, right? So those ones are showing the lowest cost. So all I do is I just hit compare here, and then I just look through it. I just scroll through it and I go to drug cost details and I just look, right? That's it. Estimated annual drug cost, $84. Estimated annual drug cost, $144, right? But the premium is going to be a difference maker, which is why before this, you saw that the cost was pretty low, right? So it was like 200 something bucks for the year, right? In prescription drugs, that's nothing. So then I look at this metformin, right? 19 cents with this company, $1.24, tier 1, right? Tier 1, not on the formulary. Here's one that's not on the formulary. So they show the drug cost is $3.47. So you guys don't have to panic if there's a drug that's, it's like you're looking at it. It's like, oh, this drug's not on the list. Don't worry about it. If it's an expensive drug like a Plavix, right? Well, then you could say, hey, you might want to consider switching to a generic drug, clopidogrel, for example. All right. But, if they say, I can't have it, I can't be on that. Well, then, we're going to have to find some alternatives to look at a different plan. So lisinopril, meloxicam, those are tier 1s, torvastatin, tier 1, gabapentin, tier 2. So yeah, so there you go. And then it gives you your breakdown, right? How much are they going to pay a month? $13. And that's including the drug that is not on the formulary there, right? So that's okay. But sometimes you'll see drugs that are not on the formulary and the cost is $500. Well, then we got a big concern. So, but generic drugs like this, it's pretty cheap. All right. So that's an example that y'all will run into, and you want to show your clients, stuff like that. So that way you can look at it and say, hey, but when I show you guys examples like this and you see a not on the formulary drug and it's a drug that is $500, yeah, we're going to have to look at an alternative and find something else. Okay. So just kind of look at that stuff. That way y'all can see if it is the case where it's something that we need to be concerned about, which is exactly why I wanted to mention that for our AEP changes and some stuff that happens during that time frame. So we just want to look at that, which is exactly why we look at it with our clients. So let me go back to share screen over here, right? So if you're looking at these hypothetical cases over here, right, and you're looking at it, right, Gus client, right? So it's just like I pull this stuff up and I look at it, and then I see, I look through it, and I see, okay, great. This person's no meds, no doctor. Okay. So that's probably not the best example, but I go through, let's go to another example here, right? And I look at it. This person's got 7 meds and 1 doctor. Okay, great. So we see here that the drug cost is $528, right? That's 672. That's 672, 636. But when we get down to the bottom, this one is $4,130. You click details, you go to drug cost, and I'm going to tell you right now, something's not on the formulary. I'll tell you that much. So we scroll down, we find it, or this one right here, it is on the formulary. Look at that. But it's $723 is the full drug cost. So I know, since the drug cost is so high, right? There you go. Gonna be something that's bad there. And there's a drug deductible of $480, right? So the estimated annual drug cost is $3,700 and change. Okay. So all you do during AEP, right? And look at this drug cost. I mean, it's crazy. Tier 4 drug on this company, $723, and she'll hit catastrophic coverage. She'll go into the donut hole, and then she'll pay nothing towards the end of the year, what I'd assume. Yeah, 181. So yeah, so clearly, that plan's not a good plan for that client, right? So you literally have all this information in here. So you're looking at a Medicare Advantage plan, right? So here's an example of a doctor, right? And this is AARP. So let's scroll down here. Let's look at Aetna. Takes the Aetna plan. Let's look at WellCare. Doesn't take WellCare, right? Or at least it doesn't say that they do. It's a PPO, so you can go in and out of network, right? So with this one, next year it might show it up, but you have everything saved. So for you, it's not like it's anything complex to pull this up, which already exists, right? And then you just look at it and see. So it's that simple for y'all. Let's see if we got some questions. Switching to better. Yeah, so that's a really good question. All right, so we got 2 questions here. Jason says, so let me go over the first one, unless there was 3, unless I missed one. No, 2. Okay. If the client has extra help, won't the drugs be the same for every carrier depending on their level of LIS? So the answer is yes, absolutely. As long as all the drugs are on the formulary, there's a cap to how much they can pay for the prescription drugs. So as long as it's on the formulary, we're good, right? So that means when you go ahead and you look through it, so Jason's question is about extra help, which is low income subsidy, right? So those terms are used interchangeably, extra help / LIS. The drug cost is capped, right? So if you look at this, and I don't know which one we just looked at. Let's just go to this one real quick. Let's go view contact. Let's go quote real quick. Let me see. Do you receive extra help / LIS? Let's go ahead and hit yes. Let's go ahead and here's the cost, right? And then let's go ahead. Now it's refreshed. Just going to hit view all plans. Look at that. There you go. Let's go to regular ones real quick. So it's going to show you right here in Sunfire. All you got to do is just click the button. So now that WellCare plan, where was that WellCare plan? That was a crazy amount. It was like $4,000.
Hey man, your screen's not sharing.
Oh, I appreciate you. Y'all gonna let Tim tell me that? Y'all are gonna let Tim tell me that. No one else is gonna help me. All right, so let's just go back real quick. All right, so this is just the client, right? Just hit quote on your client. So this is the page where I tell y'all, don't worry about checking any boxes. Just hit view all plans, right? It's got their zip code. You just scroll down the bottom. Do you receive extra help? No, I don't know. Yes. How much do you pay? If it's a client that's on Medicare and Medicaid, and we know it's this amount, full Medicaid. And if it's a client that's not on Medicaid because their income's above the threshold, it's above 1,100 change, right? You would put that amount. So either way, just put it in, hit view all plans, adjust it for you. So there was, now just to revisit that, there was a WellCare plan that was like $4,000. So let's look at all the WellCare plans. Let's look at Medicare Advantage because they're not, let's say they're not DSNP. Look at all these prices, see how it's changed. So it does it automatically for you. It's going to update that in there. And that's just part of, y'all learning Sunfire and just playing around with it. There is no one that taught me how to use Sunfire. I learned by doing with it, right? Which is why I want to show y'all how to use it and why it's a useful tool. So it's just, I learned everything I learned in this business, I learned by doing, right? And of course I had some help and people, that helped me out, which was awesome. Right. But a lot of this stuff I did learn on my own because I'm huge with self-education. It's just something that I believe is something I want to do for myself personally. All right. So Ryan asked a question here. He said, is AEP mainly switching clients to better plans or signing up new MAPD or both? Definitely both. So if someone, Charles Schumann, let's see if he's on this one. He's not. Okay. So Charles, he just had a client right now before AEP whose effective date for her Medicare is 10/1. She's getting kicked off her Obamacare. She's done. Hey, you got to get on a Medicare Advantage plan. So she just enrolled now. But let's just say, for example, hypothetically, it's her birthday is November and we sit down with her in October, right? We're not using the AEP code, right? At that point in time, if she's just turning 65 in November, right? That's our IEP, right? Or ICEP. It's her first time. It's her initial election period. It's her first time enrolling. It's her initial time. So there's no changes at all. So if it's someone's first time, which is the second part of the question, someone's first time signing up for it, then, and that's fine. Now, if someone's currently on Medicare, right, but they don't have a Medicare Advantage plan, yes, we could enroll them in a new Medicare Advantage plan for their first time, or we can change them. So sometimes the plan may not be quote unquote, like better, I would say, with benefits, but their doctor doesn't take it. So obviously they're not going to stick with it. So, it is those moving parts in there that can be some of the main reasons that why we change. Or a plan might have better dental, but they have dentures and they just got them last year. So they don't care about, $2,000 in dental and the PPO is $500. They care about flexibility with network, or maybe their current plan. Scott had this great example a while back with a client that had the adult diapers and they made a change. Scott, I'm going to mute you. Tell us about that real quick, if I can. Go ahead and tell us about that in that scenario that you ran into real quick, because that was a pretty cool reason why to change. I think a lot of people will like this.
When I walked into the house, I was visiting with her wife, and we started going through all the plans and what he had, and they really did like what they have. But what the other plan didn't offer is they didn't offer any over-the-counter drugs or over-the-counter stuff. And I explained to her, if you go with this company, they're going to give you, I can't remember, it's like $75 every month on over-the-counter. And she mentioned, says, well, do they have those adult diapers? I said, absolutely, they have the adult diapers. You can order as many as you want until the amount that was approved for y'all is used up. And that was a selling point. I mean, she literally probably would have not switched the plans or switched the plans with me if it wasn't that one simple little selling point. And just give you an example, how powerful that over-the-counter drugs and over-the-counter items has in a plan.
Because her plan, before you mute yourself, but her plan didn't cover it. So she was going to have to come out of pocket for it, right?
That's correct.
Okay.
That's correct.
All right. So, because I remember it was probably like a year and a half ago or something like that you wrote it. But that's one that always sticks out in my mind, because the client literally was going to have to pay for this stuff, but Scott got it for her at no cost to her. Right. So that was a tremendous thing. And she was thrilled when you left, right?
Absolutely. They were very budget. They didn't have much money at all. And so it was a welcome idea where she could get those for free and did not have to pay for them out of her pocket. Absolutely.
Yes, sir. Well, I appreciate you. Thank you. All right. So let's see. What about when some counties have 4 or 5-star carrier plans that we don't have? Example, Kaiser is a contract direct that you're not going to be able to get. It depends on the state, but if you're in California, you won't get that contract. Those are captive agents. Optima, I can guarantee you with a pretty high level of certainty that if you go into 100 clients' houses, less than 1% are going to have Optima, right? Anthem is a good carrier and you can pick it up. Anthem, Blue Cross Blue Shield. So there's not a problem. If you want Anthem, if you're going to be selling, my advice to agents too, for y'all as well, is, we have great companies. The number one company in the entire country with Medicare Advantage plans is United Healthcare. Number 2 is Humana. Number 3 is Aetna, right? Then you have WellCare, you have Cigna, and then you have Anthem. Okay. So if you look across the entire country, those are the biggest players, right? If you go into clients' houses, you're not going to see these other plans. If you go to Florida, you'll see Freedom, which is owned by Humana. So it could be a good contract, right? But it's same thing. So yeah, so I would say, I don't know if WellCare is better than Anthem. They're beneath their bottom. I think they're lower on the list. But yeah, I don't love WellCare right now. But hey, let's see what happens when we get those ANOCs and if there's anything that's good for those plan changes. But I mean, I like WellCare in some areas. They're dominant. Ryan, you were out in the field. Ryan, can I unmute you for a second? You could tell us about that. Okay, cool. All right, so I'm gonna hit ask to unmute, and then Gus, I promise we'll get to you. I know I want to interview. So Ryan, you were out in the field, and we were looking at a plan. We were texting about it and talking about it, and they had what, one option, two options, right? There was nothing out there available besides a WellCare zero premium.
Yeah. Yeah. Literally. I mean, there was whenever it comes to zero premium. Yeah. It was literally two options available, and that's all she had. She already had it, so, but yeah, it was WellCare, and it looked pretty
It was
bleak.
like
So
the other one was a Humana plan, but it had a premium, right?
yeah. Every other plan, there were like 4 or 5 other plans, but they were premiums, and she was already complaining about not having any money. So
Exactly. So yeah, so thank you. So yeah, so he ran into that when he was in a territory, and he looked at it and he's like, hey, so I need WellCare here, but if I go to Dallas, Texas, I may not need to use them at all. Right. So it's totally subjective to each and every territory, which is why we get you all those carriers so you have them. Right. So it's good to be prepared with them. But some local ones like small, let me go to Dallas, Texas real quick. Geez, let me see. There was a client someone was with today. Oh, his name is Lewis. I wonder what that guy's name was. I forget. Here we go. We have Kinderhook. We have a Baylor, Scott and White. We have about 4 or 5 small carriers that you will never once write. Never once in the Dallas, Texas area. It's like having like like a Life Shield or United Home Life on the life. It's like companies that you're very infrequently ever going to see. In fact, I've never once seen Kinderhook. I've never once seen Baylor Scott White. I've sold a lot of insurance in my day, so I've never once seen those. All right, Gustavo, let's get to you. All right, my man, let's go ahead, and I'm gonna mute. Thank you, I appreciate it. I gave you time to get to where you were going. So
yeah, I was at the gym, so yeah, thank you.
So we got Mr. Gustavo over here, and he came all the way from Venezuela to sell Medicare, right? Like that was your objective. Yeah. So
Well, I came as to have some fun and have some vacation. I decided to stay now in the Medicare life insurance business. And dude, I've been in the business for a year almost in October. Since I met with you in Houston and I found out about Medicare, it's stupid how everything has changed for me. Starting with confidence, I had issues with FE and stuff like that, but with Medicare, dude, it's crazy. You don't have to do anything. 1, they already have it. 2, they already know what the drill is because they already have it. You're just trying to find out like best benefits. They already know everything or most of them because they've been using it, right? So what it's been thrilling is the amount of money that we can find to people that they don't even know about. And they were struggling. Like an example, remember the PPO that we were working with the United that they don't want it to change? So the lady, she didn't speak English. She didn't know how to read. She didn't know how to speak, how to read and how to write, I'm sorry. And it was crazy because it resonated with me because I got family in Venezuela that they didn't know anything about writing and reading. And as soon as we got them hooked with the $65 a month, each of one of them. So they're getting 130. They were like, dude, thank you so much. Thank you that God put us here. And that's why I'm doing this. I don't have to do anything other than just calling you and, chatting with you. And that's it. It sells by itself. And you get easy money. Imagine, let me put you this example. When I was driving here, I was thinking like, imagine these guys that do like, I don't know, 7, 8, 10 FE policy a week. That's a lot. Imagine how many Medicare they can do if they can close a fee, which is harder. So, dude, it's just crazy.
Yeah,
I'm
you're
just
right.
happy that I found out about that.
So let me ask you a question.
Mhm.
And so one thing that's important, walk me through what you do and kind of our communication when you're going through a sales process. Like so you've been doing, well, first off, how long you been selling Medicare for?
One was your training in Houston, like July 20 something, I don't know, less than a month, 3 weeks, maybe.
Yep. Yeah. You had to get
almost a month. Yeah.
So you had to get certified when,
Yeah.
after we met,
So
you had to get contracted,
yeah.
certified after that. So less than a month.
So yeah, like 3 weeks. Let's say 3 weeks, and I almost got 20 clients.
You're right there. So, okay.
Yeah.
So let me ask you a question. Now walk me through your process when you're sitting down with these clients, because he's face to face, so everyone knows. Like,
Yes.
what do you do? And then at what point do you bring me into the sale? And what are you communicating with me to make it, a relatively easy sales process?
Dude, sometimes I'm just like, they don't know what I'm doing, right? They don't know the process. So that make it easier for you, because you can talk to them, you can, build rapport, have fun, ask them questions. They're more than happy to answer, because nobody really helped them, if that makes sense. Because they receive a lot of calls, agents over the phone, they don't care. They just wanted to put them in whatever they have. So whenever you started to like, hey, do you receive this over the counter as an example? And they say, what is that? I'm like, haha, I got you. You know what I mean? And when I said, have you read the booklet? No. They're starting like do this, and being honest, that's why I have a job. And I laugh, and they're like, I got you there. So
Exactly.
process is really simple. I just ask them Medicare card, Medicaid if they have, because like you said, dual complete plan are killers. Like, dude, this is stupid how they can get $110 for nothing.
It's crazy.
And that they don't know that. So I just ask the Medicare, Medicaid if they have an insurance card, if they have it. If not, with Medicare, we can go to medicare.gov. You're explaining the drill. It's really simple, straightforward. You create an account. If they have, you find out a way to create a new password. It's really simple. You don't have to be a genius. With that being said, I ask them like, hey, what's your meds? Give me your meds. I just verified the PCP. I got it on the bottles, usually on the medicines, but I asked them like, just to make sure, and I asked them where they go and see it, because it could be in multiple locations. So I just wanted to make sure that they go to the one they want. You know what I mean? Other than that, dude, I just texting with you. Now I'm getting through Sunfire. I know like navigating and stuff like that. I just text you, and at some point of the time, I don't let them know.
Yeah.
As soon as you call me, I'm like, hey, bro, what's up? I'm just going to put you in the speaker. Boom. Or, yeah, that's it. Or I just let them know that, hey, my soup is going to call me. We're just, having a second pair of eyes, checking in this and blah, blah, blah. And that's it.
Exactly.
They don't even know. And like we did the other day, I called you just for validation, because I already sold the client, but he was like, I don't know if I trust you that much. And I just say, dude, can you just call me and back me up here? The dude already know the drill. He just wanted to listen what he wanted to listen. Boom, I got to sell.
Yeah. And like you said, would you say this is the easiest sale you've ever had?
Yep.
Okay.
Oh yeah. 100%, dude.
Yeah.
200%.
Yeah. 200%. Because he sold final expense, so he knows. And it's just really, like he just said, everything that we built on let me go over here to the Medicare. Let me go to the Medicare tools. Let's pull this on up. Let's take a look at this. I'm going to share my screen real quick. And the reason why, let me actually get the screen pulled up. And the reason why I built this and designed it is this is literally the exact process that he walked you guys through, right? So it's simple, right? Get their red, white, and blue card. He asked for their health insurance card. What doctors do you go see? Specialists. Get their drugs, right? Medicare, begin the Medicare worksheet. You got the facts. Medicare.gov. He logs into it. He looks at it, sees what they got, confirms to verify, because sometimes clients don't know. So that's a huge step, because they think that they have something. They don't. They look at the plan. They show you the card, and you assume that, oh, that's what they got. No, it may not always be the case, but it also allows you to, and you'll follow up with this in a second, Gus. And then you input the information to Sunfire, and then you enroll in plan, complete the health assessment, right? You read this stuff at the bottom. So, Gus, let me ask you a quick question. Have you
Mhm.
ever seen a client so far that thought that they had a plan that it wasn't?
Yeah.
Okay. And you got that
Yep.
information from where? How'd you do it?
Medicare.gov or Medicare.gov. That's it.
Okay. And then when you
Yeah.
log in, what's the
Mhm.
benefit for you of viewing their previous plans that they once had?
So we can know if they had Medicaid, if they lose it, if they still have it, what companies they have. Oh, give me 1 second that my dad is sitting.
Yeah.
I'm sorry.
You're
So,
good. You're good.
yeah, you can just check what they had before, companies, plans, prescription drugs. As an example, I didn't call you yesterday because I was with a client. I checked everything. I went through Medicare.gov just to check. Even though he had a new car, I didn't care. I just checked. He was on the dual complete, same plan, check. I told them, hey, dude, do you have an agent like face-to-face that you wanted to meet every time you want? No? Okay, I'm your guy. I see you on October. That's it.
Perfect.
Don't answer your phone, just answer me, or I knock on your door and see you in 3 weeks, 4 weeks.
Okay.
Bye-bye.
Great point. What do you
That's
say
it.
to those clients now? What do you say to those clients before you're leaving to ensure during AEP that they don't make changes?
Don't answer your phone. Don't call anybody. If you have questions, I'm your guy, even though I didn't do anything for you, because the way I say, I'm like, dude, if I can help you, I will help you. If I cannot, I will tell you and I leave. I don't want to, to waste your time, either mine. That's my job. If I can help with that, something makes sense for you and your family and your situation, more than happy. Other than that, if you don't like it, if you don't want it, or if you are in the best position, dude, I'm not charging anything. Most people charge $200. I'm doing it for free.
Yep.
And they laugh because I never asked them for any kind of money.
Yep.
Right. And
So-
yeah.
So right now, to be clear, you're telling me that in your first close to 30 days, you're closing in on 20 plans. You're meeting all these clients face to face. You're selling multiple different companies, and you're getting paid to sell something that doesn't cost them anything by following easy process. Okay. What did you know the 3 weeks ago you started selling it? We know that. Did you know anything about Medicare before that though?
I don't even know anything.
Okay.
But dude, I mean, it's just repeating. If you work in sales before and you sell paint, dude, it's the same stuff every day, and you're gonna get used to it. Now I'm more comfortable with Sunfire, as you were saying. It's simple. It's really, really, really simple. And to be honest with you, I'm like between 16 or 16 apps already in 3 weeks.
Jeez, that's crazy.
My goal is to be at 40.
You're gonna beat the number, yeah,
before
for
San
sure.
Diego. I want to do 40 before San Diego, dude, because my goal during AEP is to get 240 so I can get those 70Ks.
So right
You
now,
know what I mean?
That's a great point. So let's say, for example, we go ahead and we take this math and we say he's
Yeah.
averaging about, let's see, so you're at about 16 in 3 weeks. Let's take 16 divided
Yeah.
by 3. That's about 5.5. Let's say 5.5 times 4 weeks in a month. That's 22 plans. We take 22 plans and we annualize it. That's 264 plans in a year. 264 plans times $300. He'll be at $79,200. Gustavo, in 2 years, if you keep that rate up, you're going to be at 100 and let me see here. Let me multiply that to $158,400. So in Gustavo's 2 years, he's been in insurance less than 1 year right now. If he keeps up the rate that he's going at by doing exactly what he's currently doing, he'll be a 6-figure earner in the Medicare space within 2 years. That's not bad. That's pretty dang
That's
good.
my goal.
Yeah. You're going to hit it. You're going to hit it because you're doing all the right things. The biggest thing though, Gustavo, wouldn't you say the biggest thing is consistency? Like you're going out there and doing it all the time?
Dude, I didn't have confidence on myself, being honest with you. And that was an issue like I think everybody had. It's normal. We're human beings. But I don't know, dude. I was with one of my coworkers doing door knocking. The way he'll do it was easy to me. And now I'm like adapting the same way. And dude, I don't care. I just get in. If I can get an FP, that's fine. If I can get a Medicare, either way, I'm getting paid. could be $1,000, it could be $100, it could be $140 something with the health assessment, right?
Yep.
Dude, but either way, you can make 100 or whatever, or you can make 3,000. It doesn't matter. You're getting something out of it. That's my mentality right now. Like, I'd rather have something than nothing.
Agreed. So
And
we have
your
one
math-
question that was
Yeah.
that is in the comments here. What leads
Oh.
are you running to sell all these clients?
FE.
FE leads. FE leads, right?
Dude,
That's
I'm
it.
just getting aged leads. I got like around 600 leads that I'm like running, like door knocking. As an example, yesterday I did 32 door knockings and I get 11 appointments for the
Wow.
week.
Wow.
Exactly. So I'm getting FE or Medicare. I don't care. I'm just
Yeah.
gonna get something.
So
So,
he's
yeah.
out there running the same lead. He's running a final expense lead. He's not doing
Yep.
anything different, but he's following the
Nope.
steps and the processes. He knew nothing about it 3 weeks ago. He's just been an early adopter of it in his system and his program, and he's just absolutely crushing it. Right? It's the easiest sale he's ever had. He's getting paid. He's making a killing, and he's going to make a lot more money on pace by August of 2024 to be a six-figure earner. I mean, that's a tremendous amount of money in renewals, and he's not doing anything. He's not doing anything different. He just said it. He's like, I'm not a genius with this stuff. You don't have to be a genius to do it. He just learned it. He's just bringing it up. He's talking about it because you
I
don't
got you,
get
dude.
what you don't ask for, right? That's it.
We got you right now. Until you learn it, we got you. You know,
How do you bring it up? That's what Maurice is asking in
Medicare?
there. Yeah,
or door knocking.
Medicare.
I'm like, hey, do you have Medicare? Do you have Medicaid? When was the last time that someone like me checked it? And they're gonna start thinking it was a long time, and they're gonna say, yeah. So bring that up. You already got the meds. If you're doing it, you already got meds. You know, health conditions that don't really matter. Only matter the medicines. But if you're really helping them, they're gonna give you everything you need. If they give you your social, you're done. What
Yeah.
else can I give them? You know, they're
Yeah.
gonna give you everything else. So
Yeah.
it's just a simple question, as you said. Do you have Medicare? And what was the last time that someone checked it like face to face with you, not over the phone?
You're making it seem too easy, though. Is it really that easy? Come on. It's that easy.
Yeah.
Okay. All right. So
Yeah.
you heard it from the man himself. I appreciate you. Does anyone have any questions for him? Questions for me before we hop off? We're about an hour on the hour now. So if anyone's got any questions, feel free. And that's the thing. So to answer her question over here, what's your pitch? There's really no pitch, and the pitch at the door is kind of what I brought up in terms of changes and stuff like that. All the changes last time you had it reviewed, but he's working final expense leads. Okay. So it's not like it's anything that's different from what you're currently doing, how you're getting in the home, what your current door knock pitch is. It's the same person, same client. He's doing nothing different, y'all. So it's easy. Like, how do you bring it up? People ask me that all the time. I'm like, just ask about it, right? There's no beating around the bush when it comes to selling Medicare, right? You can just be direct. Like he just said, a social is different. That's invasive information. He's not asking for their account and routing number. Have you ever asked for anyone's banking information?
No. So let me put you this example just to answer that question. So the other day I was door knocking and I asked a guy for an address, like, hey dude, where I can find this address? And he was like, well, it's right there. I was like, thank you. Cool. I went, door knocked, nobody was there. My way back, I asked him like, hey, ¿cómo estás? Because he speaks Spanish and I was talking to him. And I asked him, hey dude, do you have Medicare by any chance? So that's my job. I'm an agent, so I brought up a license. I got it like printed it with a laminate.
Yeah.
And this is what I do for a living. Have anyone help you with this? Like, do you go to a doctor? Dude, that was a free sell.
That's how easy
I
it
didn't
is.
have a lip for him. I sit with him, even though he didn't have his Medicare card because he never had one. I asked him for the social. He gave me the social. I'll call United Healthcare, do the Medicare checkup, all that stuff. And I was be able to give him a new card plus an upgrade on the Medicare. And I didn't have that lead.
Exactly. And that's the thing too. So that's being creative with the sales process, following the information. So he doesn't. One thing that he's really following is he's not calling me while initially it's obviously going to be different, but these sales now he's just like crushing. He's like, yeah, I get 15 sales in, 16 sales in. Like he doesn't need as much support because he's done it so many times. He knows the processes and procedures, but he's still double checking on everything. But you like, he's not calling me to be on the phone for 15 minutes, trying to get the meds, doing these first few steps over here, right? This stuff is all stuff that he is doing on his own, right? Getting the information, and then we can communicate to see what we can do, right? So I don't want to be, with the agents, right? I want you to do the legwork first. So he's not calling me while he's in the home. Oh, I don't even have the red, white, and blue card, or they don't have it, right? Perfect. We're going to text about that stuff and get it. So that way I can walk you through the process, right? I don't want to give you a hard time, but I don't want it just to be it is the easiest sale, but I want to make sure that you guys are learning it while you're doing it, right? I just don't want to do all the legwork for you. If someone just does everything for you in life, you don't appreciate it at all. It's like, you don't respect it. If someone just gives you a bunch of money, you're not going to respect the money. So we got to make sure we're doing the legwork there. And then one question that someone had is when we add new non-resident states as Sercon and Nipper, yep, they update the carriers, the insurance companies pull that stuff from the actual website, from the NIPR, the government websites, whenever you're adding in a non-resident license. So if you're going to travel to another state, they pull it, but you have to tell us so we know to appoint you in that state if you're going there. So with that said, that should be about it. I appreciate everyone. Gus, you're a legend. If you're not now, you're becoming one. So thank you. I appreciate you, brother. Everyone have a wonderful evening. Thank you, guys. I appreciate y'all. Have a great evening.